Hi, this is Joe Courtney from Washington, D.C. Our office has been organizing a number of web camera letters to your congressman and going over some of the key issues regarding the health care bill, which is now being debated and will be voted on shortly by the U.S. House of Representatives. We have a letter here from Dan in Brooklyn. I have a pre-existing condition and don't understand the look-back provision and the 3-month exclusion. Does this mean that the provider has a limited amount of time to reject me, or can they only use the exclusion for a limited amount of time? My condition is chronic and stable, and my condition is chronic and stable is the best I will ever be. This concept is very important to me and my spouse. Thank you, Dan, for asking this question, because the issue of pre-existing condition exclusions is one of the key driving forces and goals of healthcare reform. Under existing law today, if a person leaves their health plan either because of a layoff or because of a move to different parts of the country, the existing law protects you to move into a new group plan if you make that move within 63 days. If it takes longer than 63 days to find a new health plan for coverage, if you have a pre-existing condition, the company is allowed to look back over a period of 6 months in terms of whether or not you have a condition like a cancer or diabetes, high blood pressure, and if you do have a condition like that, then you are excluded from coverage for that condition or illness for 12 months after your new employment starts and your new coverage starts in the group health plan. My office has had many contacts from individuals who that gap in coverage when people switch from one group plan to another has been extremely difficult, and in many instances has resulted in interruption of needed care. The health care bill that we have before us will completely and totally abolish the whole mechanism of pre-existing condition exclusions for people in group health plans and people who are also individuals seeking individual coverage. That exclusion will kick in 2013. The provision that you're referring to, Dan, in your letter, which talks about a 3-month exclusion and a look-back period of 30 days, is really a temporary arrangement to try and provide some relief as we transition from the existing system, which is very harsh, to the complete elimination of pre-existing condition exclusions in 2013. So the answer to your question is that yes, there still will be some look-back of 30 days and some exclusion for any condition that you have that's shown itself within that 30-day look-back period, and that exclusion has been shortened now to 3 months from the 12 months that exists under present law. It's not a perfect seamless coverage, but it's only a short-term carryover for people until we go into the National Purchasing Exchange, which kicks in 2013, and under that system, we will once and for all completely abolish the practice that insurance companies engage in today of excluding people from coverage for pre-existing illnesses or conditions. Second question is, I read your message about your bill to remove the donut hole in Plan D. My question is, how are you going to fund this? The hole was to lower the cost of the program. Regards, Steve from Summers. Steve, you are absolutely correct. The Medicare Part D program, the prescription drug plan, today the way it's set up is that if you buy into one of these plans and pay your monthly premiums, you get coverage up to $2,700 worth of prescription drug costs. At that point, you fall into the infamous donut hole, and you will be uncovered till you get approximately to $6,000 in prescription drug costs, really a catastrophic situation to really kick in further coverage beyond that. The donut hole obviously has been a huge sore point. About a quarter of seniors in America who use the Part D program fall into the donut hole, and it is extremely difficult for people who are paying premiums to find themselves in a situation where they're paying 100% of the cost of medication. Filling that donut hole, eliminating the donut hole, costs money. You're absolutely correct. And the way we fund it is by changing the system that Medicare pays to pharmaceutical companies for prescription drugs, something that frankly should have been done when the bill was first passed. It gives the Secretary of Health and Human Services the authority to negotiate a better price with the pharmaceutical companies for a select group of seniors, the so-called dual eligibles, people who are over 65 and also eligible for Medicaid. Today, people in that category under the Medicare system pay a much higher payment for prescription drugs to the pharmaceutical companies than the Medicaid program, the Title 19 program, presently operates with, because they have a very robust, strong manufacturer's rebate with the pharmaceutical manufacturers. I know that may sound a little in the weeds there, but the bottom line is that it will generate about $42 billion in savings using, again, the government's ability to negotiate a better price with the pharmaceutical companies, and we take those savings, apply it towards the donut hole, and over a period of time we will completely eliminate that gap in coverage, which people again find extremely frustrating when they're paying good money for their monthly premiums. It'll take about 6 years or so to wipe out or close out that donut hole. In the meantime, another aspect of this bill, for people who are in that donut hole during that transition period, they will be entitled to a 50% discount on brand name medications while they're in the donut hole. So for example, a woman in Colchester who I talked to in August, her mother is in the donut hole. She had just come back from the drugstore having filled a prescription for her mother, had paid $900 for one refill because, again, there's no coverage while you're in the donut hole. A woman in that situation under this discount, the temporary discount, would pay only half the cost of that refill. Still a lot of money, but certainly significant relief. And under the system that we're going to adopt, if the bill is passed, you would be allowed to deduct the full cost of the medication, the $900 cost, towards your deductible if you're in the donut hole. So you'll get in and out of the donut hole quicker under the bill that we're proposing. And in addition, we're beginning a phase out to reduce the size of the donut hole and eventually eliminate it by 2019. Next question is from Vincent, Lieutenant Colonel, retired in East Lyme. He asks, with respect to the introduction of H.R. 3962, would you please provide me with your assessment of the impact of this proposed legislation on military retirees who are participants in Tricare but who are not yet Medicare eligible? Can you apprise me of any other proposed changes to Tricare fees and benefits that I should be aware of? Thank you, Vincent, for asking that question. Obviously, we're the district that has the largest operating military base in New England. Lots of military who use, active duty military who use Tricare, and a lot of military retirees who are eligible for Tricare. This is a big issue. Section 58B of the legislation clearly indicates that Tricare benefits and VA benefits are completely left intact under the full control and operation of the Department of Defense in the case of Tricare, the Department of Veterans Affairs in the case of Veterans Benefits, and those plans are treated as quote-unquote acceptable coverage, which means that they are completely exempt and will continue to operate outside of the National Purchasing Exchange, which is really the real guts of the reform bill that will go into effect in 2013. So the VA and the Tricare system, again, will be left completely untouched by this healthcare reform. To go further in terms of your question regarding any increase in Tricare fees, there was back in January a push in the Pentagon to raise the co-payments for Tricare prescription drug costs. The National Defense Authorization Bill, I sit on the Armed Services Committee, acted swiftly to eliminate any increase in the Tricare co-payments for prescription drug costs. So that area of the plan is completely protected, and there will be no increase in out-of-pocket costs. We also have some good changes to the Tricare plan to extend it to reservists and their families, and our office, if you have any questions or know any people who do, would be happy to follow up on that in more detail. You can certainly contact our office in Norwich or in DC. So thank you for the great questions, which cover key areas of the bill: pre-existing condition exclusions, the Medicare Part D donut hole, and the bill's impact on Tricare and the VA. We'd love to keep this dialogue going up and encourage you to contact our office by email or phone call with any questions that you might have, and look forward to continuing this outreach to the people of Eastern Connecticut.